evening, everyone. Thanks all for coming. I thought it was quite interesting that that UTS asked me back. Obviously, I didn't do dentistry here, but did it at Sydney University, and so I think it's a great opportunity that you guys actually get to see what the other side of the coin is like. As you can see there, I did 2 degrees. Did biomedical science at UTS, which was at Gore Hill. So that was finished out in '94, and then did honours after that. Worked a couple of years, started my own business, and then went and did dentistry in '98. Finished in 2002. So I went about it in a really long way because at that point in time, dentistry wasn't a postgrad degree. That's 9 years of study for me. So, but I am a general dentist, which means that I don't have a specialty, and it allows me to do whatever dentistry I want to do. So I've got a practice in Neutral Bay. I've got 3 rooms there, and I work with my therapist, who's also a hygienist, and that means that she is able to see children and do some of the basic dentistry. And essentially I will do the rest of it. So I mean, a typical day for us, we'll see somewhere in the range of 10 to 15 patients. And what I'll do is I'll actually be moving in between my room and her room to do the checkups. And the third room there we have is an overflow room. We use it to do whitening in that third room. And I also have a separate dental imaging business that I run out of the front of my practice. So nowadays, with dentistry becoming so modernised, this is typical of some of the radiographs that we've got. We can put it up all on the screen. We've got the digital cameras. All the information is there at our fingertips. All our notes are all there. The practice is pretty much digitized. So this is one of the toys that I get to use every day. I've got my own cone beam CT, which means that I can take panoramic X-rays of patients. I can take flat films of their head in many different views, and I can take the 3D CTs of the skull as well. So that's an example of a lower left mandible there, and you can see the simulation of the mandibular nerve going through the canal, and that allows us to plan things like third molar surgery, wisdom tooth surgery. We can actually generate images like this, so we can plan the entire treatment before. We know where the risk, where the nerve is, and so where the risks are going to be. We can even do a 3D printing of the skull as needed. Sometimes we use surgical guides for different work. So I mean, this a typical day. We would be doing filling. We are able to show the patient what the mouth looks like, and then what it looks like after we've done the filling. So we've really done it, because they can't see inside their mouth. This is an example of an old silver amalgam filling, silver mercury filling, and so we changed that around because those old silver fillings, they cause cracks in the teeth. So we can change it to a white filling, and it looks a lot more aesthetic, but it also prevents their teeth from cracking further down the line. Here's an example of in-chair whitening that we do. So, in just an hour we can make a dramatic difference to their smile, and it's very easy to do. But a lot of what we do in dentistry is elective. So what that means is that we get that the patients want to have this work done, and it's really gratifying because we are actually changing their lives. When a patient comes to us looking like this and they don't like their smile, they want to change, and in just an hour we can add a little bit of white plastic material, we call it composite, to the teeth, and change their lives completely. They now have the confidence to smile. Here I've got a case where the patient has a tongue tie, not able to stick out their tongue. They have difficulty speaking, they have difficulty eating, and with a dental laser we can revise that. you can see that the tongue tie sometimes goes right to the tip of the tongue. And as soon as you relieve that tongue tie, that's when they're able to really stick the tongue out. That's an immediate before and after shot. So we have patients like this where they come to us and they're missing teeth and they have dentures and they hate their dentures. They're worried that the dentures are going to fall out, that they're going to talk, and suddenly it's just going to come flying across the table. You know, and they aren't able to chew their food well. They aren't able to taste their food as well because the dentures cover part of their palate. And so what we can do is with the help of the machines like that cone beam, we can plan implant surgery. Here's 3 of the 6 implants that we use in her. So we completely restored, you know, her smile, and so she's able to chew and eat, you know, with confidence again. You know, we have patients that you know, have a lot of wear of their teeth, or they just haven't taken care of their teeth. In this case, look, you can see the yellowish dentine, which is the inner layer of the tooth shining through, and you know, we can apply a porcelain veneer to the front of their teeth. And again, completely change their smile, and I think you'll agree she looks amazing after. But here's a case, Invisalign. Some of you may know that. It's an invisible sort of technique to move teeth, so we can move those teeth forward like that. Here's another case, just a couple of teeth, and very easy to do that with some of the clear aligner systems that are available nowadays. You can still do it conventionally with the brackets and braces, but a lot of adults certainly prefer not to nowadays. Something that you might not have seen is a case like this where a patient comes in, and if I was to do you know, porcelain veneers for her, you'd be looking in excess of, you know, $10,000 to $15,000 of work. Patients can't afford that. So what we can do is, you know, we have a product called the Snap-on Smile. This clicks on over the existing teeth. She's able to eat, to chew, you know, and you know, she goes looking like that picture on the right very, very quickly. Here, same sort of thing. A guy, he's missing some back teeth. Put the Snap-on Smile in, and he looks a lot younger. Here's a case of a smile makeover using some more of the traditional methods. We've got bridge work here, we've got veneer work here, we've got denture work, we've got implants as well. Right, so you know, that makes a big difference to her life, and she's, you know, able to smile again. So, you know, all of the things that we do, you know, we learn the real basics at university, but really you never stop learning. And I think almost every technique that I've done there is learned outside of a university environment, and you really have to be prepared to continue your education once you finish. But we take work experience students all the time coming through, and they'll you know, get a chance to see what dentistry is like. I mean, you don't really know whether you're going to like dentistry. You don't even know, some of you, if you can stand the sight of blood. Right? So, you know, when you're staring down in someone's mouth and there's blood coming out at you, you'll very quickly know. All right. Thanks very much.